Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about a special form of genetic peripheral neuropathy. It's called Charcot-Marie-Tooth disease, or CMT. Charcot-Marie-Tooth disease is a peripheral sensory and motor neuropathy where you get motor weakness and motor atrophy, so it's starting shrinking of the muscles, and it's more common in the legs and feet, but usually once you get this disease process, you're going to actually notice it in the hands and arms and the legs and feet. And it typically appears in adolescence or early adulthood, but it may even develop later on, like midlife time. Symptoms, like we said, it's weakness in the legs, ankles, and feet, loss of muscle bulk in the legs and feet, significantly high arches. We've talked about cavus foot in the past. A high arched foot where you've got a really severe high arch would be Charcot-Marie-Tooth type foot. And curling of the toes or hammer toes where the toes curl down. That's typical of Charcot-Marie-Tooth. Decreased ability to run, both because of weakness and because of deformity of the feet. Difficulty lifting your feet off the ground, so a lot of times we'll get foot drop, or when they're walking, they get kind of a slapping gait where it kind of hits the ground continuously as they're walking. Because of that, they'll get a kind of an awkward gait pattern, or awkward walking pattern where they're going to get really high steps because they have to not trip over the toes. So they also have that symptom where they're going to have frequent tripping, frequent falling because of the weakness of the legs and also tripping over the drop foot toes. And then of course you get the decreased sensation. So you don't have normal feeling in the tips of the fingers and the hands or top of the foot or the legs. Charcot-Marie-Tooth is actually a genetic condition. It's a genetic disease where you actually have a deformity in several different nerves. It can be any one of those several different nerves. And what it does, it actually causes you to have an abnormal mutation or damage to the protective coating of the nerves. So the nerves are not working like they're supposed to, which causes weaker messages or slower travel of the messages to the nerves, to the extremities, and to the brain. Risk factors of Charcot-Marie-Tooth is really hereditary. If you have other individuals in your family that have it, it increases your chances of having the same disease. But there are other causes. You can get a Charcot-Marie-Tooth from the types of damage that diabetes can cause on the nerves, for example, and you'll still get it even though it's not common. There are medications, especially chemotherapy type medications, that can cause this type of nerve damage and can lead to Charcot-Marie-Tooth. That's not a true genetic cause, but is a toxic cause. And so in those cases, it's a pretty big problem, a pretty big situation. Diagnosis, there are really three different pieces of diagnosing a Charcot-Marie-Tooth. One is the physical exam. You're saying, okay, is there signs of weakness in the arms, legs, hands, and feet? Is there decreased muscle bulk? A lot of times we'll describe it as a inverted champagne bottle. So the leg comes down and it goes down almost like a champagne bottle, where it gets a lot skinnier when it gets to the ankles than it should be with a normal muscle mass. Reduced reflexes. Reflexes are a really quick and easy way to say, okay, something's going on that's more than just the typical peripheral neuropathy. Severe foot deformities, the high arch, the hammer toes. Sensory loss, of course, the hands and feet. And you can't even see it. You could even get some symptoms elsewhere, like hip problems or mild scoliosis can also be associated with a true genetic Charcot-Marie-Tooth. So physical exam is the first thing that we'll typically do. The second part of the exam is going through and doing testing, nerve testing, a nerve conduction study. This test will see the speed of the functioning of the nerves, and you'll have a delayed or weak response in this nerve conduction velocity test in Charcot-Marie-Tooth. You can do an EMG or an electromyography or a test to see how the muscles are reacting likewise. And that will be decreased, of course, because of your loss of muscle mass and your weakness in the muscles. You can do a nerve biopsy where you can actually take a small piece of the peripheral nerve and have it evaluated in a laboratory where they can actually look and say, okay, is this Charcot-Marie-Tooth? There is distinct analysis that can be done to determine that that's the case. You can also do genetic testing. There are certain tests that work really, really well to say, okay, I have Charcot-Marie-Tooth. Then it comes down to what are the treatments. There are not a lot of great treatments because it's a genetic problem. So typically what you're going to do is say, okay, I'm going to do something orthopedic-wise, orthotic-wise, bracing-wise to support, but you're likewise going to have physical therapy and occupational therapy. The idea, the best thing you can do with Charcot-Marie-Tooth is the more you're able to move, the more you're able to do, the less nerve and muscle failure is happening because you're using them and you're doing things and functioning. And so that's one of the big things you can do there. They are continuing to look for other treatments. They are continuing to look for medical treatments and other things like that. There are home remedies. A lot of times when we're treating peripheral neuropathy, this type of genetic peripheral neuropathy of Charcot-Marie-Tooth, we're still going to say, okay, we want to go through the exercise process. We want to improve stability, whether it's bracing or orthotics or biomechanical evaluation. And stretching is an additional treatment that we don't do for all types of peripheral neuropathy. But in this case, because of the muscle atrophy, the stretching is very, very valuable. So the big thing is, if you're having an increase in muscle weakness, you're having the symptoms of peripheral neuropathy, and you're worried that you might have Charcot-Marie-Tooth, especially if you have family members that do, it is important that you get evaluated and determine if you truly have a peripheral neuropathy, and secondarily, if you have Charcot-Marie-Tooth or a genetic type peripheral neuropathy, because there's things that can be done to prevent the continued damage to the nerves that happens with Charcot-Marie-Tooth. This is Dr. Brandt Gibson, and this is